or if they are unable to assume the left Sims position. Patients should never be given enemas while lying on their right side or if they are seated on a toilet or commode, as these positions do not allow the solution to flow up into the colon. It merely collects in the rectum, causing dilation and the urge to defecate immediately. Things to remember specific to giving large volume enemas are, first of all, the temperature of the solution needs to be approximately 105 degrees Fahrenheit. Solutions that are too cold cannot be retained easily by an individual, and if it's too warm, it can cause irritation, pain, and damage to the intestinal mucosa. Also, the tube should be inserted only 2 to 4 inches into the rectum. Most tubings on enema containers will have a marking at the 2 and 4 inch point. Never force a tube into the rectum, as it can cause damage and puncture the intestinal lining. If you are meeting resistance when you're trying to insert the tubing into the patient's rectum, stop, do not force it, but remove the tubing and report it to the nurse. The fluid should be allowed to enter at a rate of about 5 to 7 minutes. That's slow, but the slower the fluid enters, the more the patient will be able to tolerate it and the more that you are able to actually give them. The bag containing the solution should be approximately 12 to 18 inches above the anus. A bag that's hung higher than that will create a lot of pressure, causing discomfort and increasing the urge to expel the contents immediately. If the bag is lower than 12 inches above the anus, it's probably going to be too slow and the solution will not go in. Now, I'd like you to watch a demonstration of administering a large volume enema. Explain the procedure to the patient and provide for privacy. In the bathroom, adjust the clamp on the tubing and snap it shut. Fill the container with warm water, 105 degrees to the 1000 cc line. Open the packet of liquid soap and place in the water. Mix the solution gently using the tip of the tubing. Run a small amount of the solution through the tube to eliminate air and warm the tubing. Take the equipment to the bedside. Place a chair at the foot of the bed and cover with a bed protector, and place the bedpan on it. Elevate the bed to a comfortable working height and lower the side rail. Be certain that the opposite side rail is up and secure for safety. Cover the patient with a bath blanket and fan fold the linens to the foot of the bed. Put on your gloves. Help the patient turn to the left side and flex the right knee if tolerated. Place the bed protector under the patient's buttocks. Adjust the bath blanket to expose only the anal area. Lubricate the tip of the tube. Have the patient breathe deeply and bear down as the tube is inserted to relax the anal muscle. Insert the tube 2 to 4 inches. Never force the tube. If the tube cannot be inserted easily, get help from the nurse. Open the clamp and administer the fluid slowly. If the patient complains of cramping, clamp the tube and wait until the clamping stops. Then open the tubing to continue the fluid flow. Clamp the tubing when the container is nearly empty. Replace the cover on the tubing. Encourage the patient to hold the solution for 3 to 5 minutes. Place the patient on the bedpan or assist to the bathroom. Remove your right glove and raise the head of the bed to a comfortable height. Raise the side rail for safety. Place the toilet tissue and signal cord within reach. Remove your gloves and wash your hands. Return to the bedside and put on clean gloves. Remove the bedpan and place the cover over it. Cleanse the anal area with the toilet tissue, followed by soap and water. Remove the bed protector and discard, according to your policy. Remove the gloves and wash your hands. Provide the patient with soap and water and a towel to wash and dry his hands. Replace the top bedding and remove the bath blanket. Put on clean gloves. Take the bedpan to the bathroom and dispose of the contents in the toilet. Have the nurse observe any abnormalities before disposal. Remove your gloves and wash your hands. Be sure the patient is left in a comfortable, safe position. The other type of enema is the small volume enema. There are a couple of different kinds of small volume enemas. The first might be an oil retention enema.